Hello, mates, it's Right Nation. It's all about oral health and general health with someone that I've got a lot of respect for, releasing an incredible book called Living Well with Dr. Michelle. She's been a pioneer. She's got a pain to purpose story that we'll get into later in the show. It's an absolute privilege to have Dr. Michelle Jorgensen on the show. Welcome.
Thank you. I'm so excited to be here with you.
Brilliant. Now, someone's listening out there, they don't know much about a biological dentist, or a functional integrative dentist. Just tell us a little bit about what is biological dentistry or functional integrative dentistry.
I think that that's a real great question, and there's not a lot of clear answers about it because there's no specific specialty for this. Honestly, I like to call myself a health-based dentist, and I'll get a little bit into that when I tell my story. Because health-based, you know what I'm talking about. I'm interested in understanding how does the health of the mouth affect the rest of the body and on and on. And it just makes it a lot clearer and cleaner because when I say biological dentist, you don't really know what that means. When you say functional integrative, nobody really knows what that means. So let's stick with health-based.
Health-based dentistry. So if you got a 30-second elevator pitch now, and someone's like saying, okay, what do you do? And you say, I'm a health-based dentist. How are you going to sort of just explain to them exactly what that is in a short time?
So your mouth is connected to the rest of you. Obviously, you're connected head to toe. And what research has found is that 60 to 80% of chronic disease actually begins in or is correlated to what's happening in your mouth. So if you are stuck in your health journey and you can't get over the hump and really get to that place of wellness you're seeking, look in your mouth because most likely there's something there that is the answer that you've been seeking for. That's what I talk about, are those connections.
Okay. But it seems to be, firstly, it's not conventional. I've been a physician for 26 years. My son's just removed one of his wisdoms at our biological dentist. And wow, what an expense, what an ordeal. It's taking it out, it's using ozone, it's putting PRP. He's drawing his blood out, he's getting PRP, he's having a vasovagal. For a week, he's out of it. It seems that it's not accessible, or we just have to accept a new paradigm or break the old sort of mindset around dentistry.
What I like to do is I like to say that dentistry is not necessarily in the hands of your dentist. It's in the hands of you. And it really gets to what does cause dental disease? What causes cavities? Are there ways to actually heal cavities? Are there ways to prevent tooth decay? There's a whole bunch of controversy now. In fact, interestingly enough, where I live in the United States, our state just banned fluoridation in water, fluoride in water, and it's been such a controversy and highly contested by the American Dental Association. Interestingly enough, they were sending out all of these surveys to all the dentists in the area saying, "Please contact your legislators." And I said, "Well, but I'm going to." Not agree with
Yeah.
you. I think that this is a positive thing.
Yeah.
But they're so concerned that taking fluoride out of the water is going to equate to just substantial dental disease. And I'm saying that that's really discounting the ability our bodies have to take care of themselves. And that's what my book's all about. It's really saying all medicine that we have, regardless of it's what you're using, what I'm using, whatever all of the practitioners are using, they're all band-aids. They're simply there to support our cells in doing the work they already know how to do. So we need to take a step back from the actual dental procedures and say, how did we get in this place to begin with? How did my teeth not protect themselves? What's going on there? And how can I take control of this so that I don't have to spend the thousands and thousands of dollars that, this new paradigm is asking for to do dentistry in a different way? Let's just start preventing, how about, and getting to root cause rather
Mm.
than dealing with the issues once we're already sick. And again, that's what my book is all about as well, is let's stay well instead of
Yeah.
worrying about how to fix it once we're already unwell.
No,
So for
that's
me,
right.
that's where
That's
I like to
right.
live.
Yeah, and we call it medicine 4.0. We do a lot of executive work here, as physician for 26 years, but it's preventative, it's proactive, it's personal, and it's
Yep.
performance enhancing. And so maybe big dentistry, is there such a term? You get big food, big telecoms, big dentistry doesn't want to do that because they're in a sick care model where we've got to fix teeth and we've got to do procedures, and that's the best way revenue that we can, afford the profession. Are you finding a system like that that really is more concerned about the finances and the profit rather than preventing disease?
What I find I'm fighting more than anything is a lack of information. because the dentistry, in fact, if it's okay, I'm going to share my story because I think that
Mm,
that really helps to populate where I am now and
mm,
where I believe the profession needs to go. Hopefully, not down the same route I got there on. So, I was a conventional dentist, had been practicing for about 10 years. My father's a dentist, still practicing in his 70s. I just thought that that's what I would do for my whole life and that I would just continue fixing teeth. And I was a cosmetic dentist, so I loved making smiles look great. And, that was my version of helping people improve their lives, was helping their smile to look better. And I thought that that's really where it all was. And unfortunately, after about a decade, I started getting really sick myself. And like anyone who starts to get sick, you just start, trying everything. So I started having gut problems. So we took all the bad foods out of our cupboards and, switched it for all the better foods and thought, okay, this is the reason. And it helped a little, but it didn't help a lot. And I still started having worsening symptoms. I was having major just memory problems, and I've always had a good memory. So this was very different. I couldn't remember a patient's name from room to room. And I knew that something was drastically wrong, but the big one was numbness. I had just painful numbness in my hands. I couldn't sleep at night. I couldn't blow dry my hair. I couldn't hold a pen, and I couldn't hold my dental instruments anymore.
sure.
So I knew something was wrong and nobody could tell me what was wrong. I went to
Mm,
doctor after doctor. This is the story so many of you probably have heard as well or tell yourselves. Went to doctor after doctor with no results. And I finally put the practice for sale because I literally couldn't do my job anymore. And I didn't know what I was going to do. I was in my mid 30s, had 4 young kids. My
sure.
husband also worked for the practice. We had debt on the practice. So literally, we did not know what we were going to do. And I was reaching out to anybody and everybody on what could I do instead of clinical dentistry.
Mm,
And finally, someone said, "Have you looked into mercury poisoning as a probability?" And that was the first time, literally the first time I had ever heard those words. Okay, so I'd already been a dentist for 10 years,
mm,
and I'd been inside the profession for many years before that through my father, through schooling. First time anyone had ever said that.
sure.
And I said, "Well, I don't have any silver fillings because I knew silver
Mm,
fillings are 50% mercury." And he said, "No, it's not the fillings you have. It's the fillings you've been drilling out for the
mm,
last 10 years."
wow.
And remember, I was a cosmetic dentist. So
Mm,
people come, they don't like the look of the fillings. They say, "Can you drill them out?" So where's the dentist's head? Right above the patient's
yeah.
head. Mercury vapors rise. He said, "I think it's probably worth getting tested." And literally, I had learned in school that if I told anybody that mercury could be a problem for mercury fillings, that I would lose my license. So
Sure.
that's where things were, right?
Now I'm
So
going to
I thought,
stop you there
well,
now. Who was this
yep,
person? Because this person was obviously had some weight or credibility because you're a conventional person in dentistry. Who was this person that came around you and said it could be mercury?
he's somebody that you would call a biologic dentist. He had been through his own journey as well. And he said, "You sound so much like me." And really, I was just at the end of my rope. I
Mm,
didn't have any other options, nothing. And he said, "Well, it's a simple blood test. It's a simple test. Go get tested." So I got tested. That's what it was. Mercury
sure.
toxicity off the charts. Never expected it. Had never heard about this ever being a
Mm,
concern for a practitioner or a patient. Remember, I was told that I would lose my license if I said a patient had, that this could be a problem for them. So I had to learn how to get rid of the mercury in me and still keep doing my job, which wasn't easy. But I found that there were protocols to do that. And that started me on my path for my own reasons, not even for my
okay.
patients' health.
So
And
did you
that's where I
see a
started.
functional medicine doc and then they did a test, or did you do a hair tissue mineral analysis test, or what did you do to, ascertain the level, number one, and then two, what was your protocol?
Yep. So as you know, Mercury likes to hide. I talk
Mm,
about how it goes and hides in neighborhoods and, nobody can
mhm,
rat it out. And so I had to do what's called a provocation test.
mm,
So Mercury had to be pulled from my organs, my tissues, and then urine is the best way to find the mercury that is from dental fillings. There's different mercury. There's methyl mercury. There's elemental mercury. This is elemental mercury that we're dealing with when we're looking at dental fillings. So it's going to be excreted more in the urine than in hair, than in blood, than in any of the other areas. So the kind of mercury I was looking for in urine, did a mercury provocation test, found really, really high levels. So as you know as well, mercury doesn't just go away overnight. It's one of those that's a slow, insidious process.
yeah.
And I feel like I probably still even have a little bit of mercury left in my brain. People that know me now, they say, you couldn't move any faster if you tried. So I don't know that you have much mercury
Mm,
left, but I've always been that way. So
mm,
I think, I still feel like maybe there's a little going on. But I
okay.
had to do a long, slow detox. And I was originally told I had to do about 130 IV treatments, but
Wow.
that wasn't conducive with my life. You know, again, 4 young kids, busy dental
Mm,
practice, trying to keep my head above water. So I did slow chelation with EDTA and things like chlorella and slow chelation over time, making sure my liver was, working as it should, making sure my kidneys were working as they should, making sure my bowels were working so that
mm,
if I did get any, it would move through without stopping along the way. And it was really a whole body process. So it was
mm,
working with a functional medicine practitioner to say, let's get every organ and every system working correctly so that my body could do the work of getting rid of this.
yeah.
And that's really what I had to do. And it was about an 8 year process from, to
Wow.
where I really felt like I've got my brain back again. Does it take that long for everybody? Probably not, because I still had some exposure. I was implementing all of these precautions using mercury filtration masks and all sorts of ventilation and things in my practice, but I was still in the building. I
Yeah.
was still I was
That's
still
big.
probably getting it in some in a lower degree than I was originally and trying to get it out. So it took longer, but this is
Mm,
something I tell people a lot. It's all about getting your body working and every single
yeah.
cell working. And it's not going to be an overnight process. And I'm sure you work
Mm.
with a lot of people that wish it were, 30 days, let's get
Yeah, no, it
better. And
doesn't. Yeah,
it
especially with
doesn't work.
environmental toxins, that's another ball game, especially if you've been now still exposed to it. But it's interesting that you did chelation. We used to do that many, many years ago and sort of not. And I love the way you said slowly because a lot of this chelation's done too quickly, too aggressively. I don't know, maybe it still does work, but we've done it far slower with the chlorellas, the zeolites, the bentonite clays, the infrared saunas, even using hydrogen peroxide. I've learned a lot from Thomas Levy. Do you know the cardiologist who wrote? So
Oh
he's
yeah.
been on the show twice. Hal
Yep.
Huggins was one of his mentors as well. But tell me, because I mean, you're obviously in the space now in terms of mercury detoxification, obviously looking at the genetics and the MTHFR in phase one and phase two. What do you think the best way is to get this mercury out of the system?
I think that the genetic component is an important one to understand. And that really people will say often now, why is your dad still practicing and he's never had a sick day in his life? How can that be? Well, I've since been tested MTHFR genetic variant as, I've got both, one from mom, one from dad. Dad only had one. And so I
Mm,
couldn't detox the same way that my
mm,
father can. And I talk to practitioners all the time. I'm constantly talking to dentists saying, do you know about this? Are you concerned about this? Because now I don't know what your
mm,
research is showing, but I'm seeing that a third or more of the population probably has the same genetic variant that I have
mm,
that doesn't allow the body. I like to think of it as like a UPC code.
mm.
It doesn't allow the body to tag things very adequately or accurately, so it can't get rid of it very well. So that was my issue. My body held on to it, didn't know where to put it. So it
Yeah.
just socked it away into my brain, into my nerves, and all the places that mercury likes to go and hide. So I think that understanding the genetics is an important piece. It's saying, okay, could this be something that you're just genetically more prone to? And then understanding things like glutathione and, the antioxidants and how to actually deal with the process of these toxins in the body. My body doesn't create or utilize glutathione as well. So I have to add more of that. So I feel like the genetic component is actually important when talking about a methodology because what works for me doesn't work as well for
Mm,
other people. I tried to do a very fast detox and literally almost died. I felt so horrendous.
yeah.
I
That's good.
I couldn't do hardly anything. I used a product called Cyto Detox, and I could
Mm,
do an eighth of a drop a day, and
mm,
that's it. And they were recommending like a half of a dropper full a day.
mm.
And I thought I was going to die. I was down to like 110 pounds. My mother looked at me and she said, "Should we like start working on your funeral here?
Yeah.
What's going on?" And you can't do it. It's not a one size fits all process. That's what
Yeah.
I've really figured out. It's not a one size fits all. You have to figure out what can your body do and take it at the rate that it can go.
That's
So
true.
it's
Yeah.
hard to just say this is going to fit
Mm.
for everybody because I don't think it is.
But I think the premise is slower the better. I think people are trying to do this
Yep.
detox way too fast, and I think that's when you can get into trouble and cause more
Yep.
problems than good. All right, so that was your story now, and obviously you petitioning to, in the dental community. What is happening in terms of South Africa and Africa? They're still using these silver fillings, conventional. I can't understand it. Are you making headway sort of legally in the field there to say, listen, there carries huge risks having silver fillings? People are going to be listening now. And so maybe you can just give the composition firstly of these silver fillings and where we are with regards to the processing and governance not to use these composites.
Yes. So silver fillings are, they're called silver or amalgam fillings, 50% mercury. And those are still allowed in the United States, as it sounds like they are in South
Mm,
Africa as
mm.
well. There has been guidelines to not use them in children under the age of 6 or pregnant women. But I always say, well, if that's the case, then why anyone?
Yeah,
you
exactly.
know, then why anyone?
Exactly.
So, but I really feel like, particularly here in this country, it's a matter of legal liability. The way that the United States works from a litigious standpoint is if anybody were, FDA were to come out and say that all of these mercury fillings have been problematic, can cause problems with your health, every dentist that has removed or placed one will be under a class action lawsuit. And so it simply can't happen. It just won't happen. They can't because the regulatory agencies won't allow that to happen.
Mm,
So really the information has to be shared through practitioners. And, that was a long answer to your original question, which was, is this all about money and is this all about profit and where's that coming from? I think it's a matter of lack of education. So myself as a dentist, I knew nothing about this. I had never heard about it. All I knew was Hal Huggins. You mentioned his name. Hal Huggins lost his license and couldn't practice because he was saying that, removing metal fillings would heal people's MS and other issues. And he literally he had threats on his life numerous times, and it wasn't a good situation for Hal Huggins. And
mm,
so that's what they told us as students is don't go there. You're going to lose your license as well if you do this. And really, as dentists, we're taught to fix problems. That's our job. Our job is to keep teeth, even if they shouldn't be kept. This is the case of root
mm,
canals, and we can talk about that, but keep teeth no matter what. Our job is to fill holes and, fix up stuff. So it's a little bit of a mechanic's job. There's a lot of hands-on work, and it keeps dentists busy because there's
mm,
plenty of dental disease to go around. Unfortunately, there's
mm,
cavities, there's tooth decay. So dentists are busy. And honestly, as I've tried to share this information with them, they'll say things more like, I'm comfortable.
mm,
Why would I need to get into some of those controversial things? Why would I need to go and do research? Why would I need to stretch myself when my practice is doing fine the way it is and I'm comfortable doing what I'm
yeah.
doing? So for me, it's less about profit and dollars and all those kinds of things and more almost just about comfort and lack of information.
Mm,
We just don't know what we don't know. And for me, I started with mercury, learned that this was shockingly problematic in the profession. No one was talking about it. And as I started down the path, doctors like yourself and others started saying things like, well, do you know about ozone? Do you know about PRF? You mentioned some of these,
mm,
do you know about PRF? What are your thoughts about fluoride? How about root canals? Have you heard these
mm,
controversies? People like you started introducing these concepts to
mm,
me. And because of the way my brain works, I'm a question answerer. If I have a question I don't know
mm.
the answer to, I go and find it. And I
Yeah.
just kept seeking and found things I never thought I would
Mm,
discover that correlated mouth health with overall health.
mm.
So it's
Yeah,
comfortable and it's
it
harder to
can
go
be.
this route,
But
you
I think
know?
for you, you started asking big questions because you got sick. So if you never got sick, you might
Exactly
have
right.
carried on in that same
Yep.
vein. That's number one. The second
Yep.
thing is, I mean, I don't know why the dentists are not looking and saying, well, it's a profession that has the most suicide. That's
Yep.
probably one reason from the mercury, which no, you're
You
dealing
got
with
it.
people with pain and it's really stressful. But I think there are more other professions that are more stressful. And, so it could be the mercury, number one. And two, surely they can start looking at their clientele or their patients and say, hang on, people are getting sicker faster, quicker. This is what's happening to them. There must be other types of root causes, probably coming from the mouth. Never mind the research, that Thomas Levy has shown about the bacteria
Yep.
that are found, 100%. He did a meta-analysis, 100% of oral bacteria were found in, the cardiac arteries. So it seems that it's more, head in the sand ostrich type of mentality than sort of being comfortable. I can't understand with a plethora of disease how they're not asking the questions.
I agree with you. And it's a frustrating thing. And typically, when I start to talk about it, people start to roll their eyes.
Mm,
They go, she's one of those crazy ones. And honestly, that's one of the reasons that I call myself health based. Because when I started practicing this type of dentistry, I called myself holistic.
mm,
Well, holistic brings a whole slew of other of other stereotypes.
Yeah,
You
crazy.
know, they're thinking that I am anything but science-based. In
Yeah.
fact, one of the things one of the things that I saw on just even a comment the other
Mm,
day, a dentist commented something, said, "Yeah, all we have, there's no science here, only feelings." And I'm like, "Oh boy, are you
yeah.
ever wrong?" Because I
Mm,
have to back everything I do by about 10 different research studies.
yeah.
Everything that every conventional dentist is doing, they don't have to back or
Mm,
support anything they do. They just keep doing it because they've been doing it, you know?
yeah.
But for me, changing the norm and the status quo, I have to actually have science that backs everything I do. So yeah, holistic was not a fit. People
Yeah.
thought I was going to be doing, peace signs and, incense and beads
Yeah.
and all these kinds of crazy things. I'm like, no, 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 no.
Mm,
My office is the most technologically advanced. I'm sure your biologic dental
mm,
office is as
mm,
well. Most
mm,
technologically advanced dental office you can go to
yeah.
in the entire area. This is
Mm,
no beads and incense going
yeah.
on. So that's why I switched to the health based. I'm like, well, at least people can kind of figure out what that might mean by that term.
Exactly. But we got about 48% of our listeners are in the US now. They want to go to a functional integrative dentist or a biological dentist. Is there a group, a professional body or a health-based body that people can go and have a look at that can give them some type of guidance and protection and governance? So these colleagues are getting together and doing conferences and they can find a health-based dentist where they live. Does that exist?
Yes, it does. There's the first organization that I found when I got sick. It's called the IAOMT. It's actually an international organization as well. There's dentists not just from the US there. And they do have a directory on their website that you can find dentists who are not necessarily doing everything I'm doing, but at least like-minded. I also have a directory on my website that's also an international directory.
Mm,
So, livingwellwithdrmichelle.com, if you go on there, they are dentists that I have personally vetted. And again, not everybody does everything, but we have really specialized or specified this person does safe mercury removal. This person does root canal tooth removal with
mm,
PRF and ozone. This person, what specifically they do. So yes, there are organizations, and interestingly enough, there are forums now that are growing. In fact, one of my friends runs a forum of biologic dentists, and I saw a post yesterday. She said that she got 50 new members in one day.
wow.
So thankfully, the interest is growing. And my huge push has been educate all of you who are listening,
Mm,
educate you as practitioners, educate, all of you, because if you start demanding this kind of dentistry, then the profession is going to have to sit up and pay attention.
mm,
The demand is there. Again, supply will meet demand. And if there's not a demand, then we're comfortable. But if
yeah.
there's a demand, then the dentists are going to have to sit up. And I've noticed that there's a younger population of dentists that are more open-minded as well. And I'm very happy to see that. I spoke at an event at one of the IAOMT conferences actually just a couple of weeks ago. And I had a lot of young dentists coming up and talking with me and asking, how do I learn this? Where do I
Mm,
go? I like these concepts. They make sense to me. I want to do this. And I think that it's going to grow. It's not growing fast, but again, public demand will help push it.
mm. All right, brilliant. And I think also a lot of these younger, maybe they're millennials or Gen Zers, is they've been on social media and they have found different things and learned different things for their profession and exposed to a lot more than just the traditional university model of this is what I learned at university, this is what my professor said, this is what I'm going to do. So I think that's pretty good. But if let's go back to fillings now, if you're not going to use a silver filling, there are quite a few different types of resins from what I understand and getting the right type of resin. How can we sort of educate and empower people listening to say, well, I've got a filling and I want to go to my dentist. Luckily, I think what's happening cosmetically is people want to move away from the silver, which is more damaging, which is a good thing. Are there different types of fillings and resins that people should know about?
So all of them are grouped into a broad category called composite resin. And it is a combination of resin and glass. They're different simply by the components of that resin or the percentage of glass. So it's called filled. The more glass that's in there, the more highly filled they are, the more dense they are. Unfortunately, that also means the less lifelike they are. So you do want the resin. You do want that for a cosmetic reason. You want it to actually look like it's a tooth, not it's a big
Mm,
block of, a big block of white stuff stuck in your tooth. So you want it to look like it's actually natural. The one thing that I do have people look for and steer away from is BPAs. So there are BPAs in the resin material. There are composite resins that have lower level or no BPAs. They're difficult to find as a practitioner. I'll tell you that they're difficult to find. Um, so there are some that have been proven. That's also a challenge. You don't want to have no BPAs and have the filling fall out,
Yeah,
so you
exactly.
do need them to be clinically proven as well. So there are a few brands, and I used to use examples of brand names, but it's so different in different countries. So as
Yeah.
everyone's listening, your listeners in South Africa probably aren't going to get the same brand. So you're going to look for one that's low or no BPA and no fluoride. There's also a lot of fluorides in these filling materials. I think the concept is that it gives kind of a slow dose of fluoride to the tooth itself when the filling is in the tooth. A lot of fillings called glass ionomer, that is a group of filling types called glass ionomer. They all have fluoride in them. Typically, these are used on children, on pediatrics, in pediatric dentistry. Is that an issue? Well, there's a lot of talk about fluoride nowadays, so we can
Yeah.
absolutely get into that about fluoride in
Mm.
pediatrics. But I like to steer away from glass ionomers at all and to composite resins that are low or no BPAs.
Okay. So summarize in 2 words, a person listening, they're going to go to their dentist and say, I want a resin that doesn't have BPA. That's as simple as it.
Correct.
And try
Yep.
and get a percentage that's high with regards to the resin. And hopefully their dentist is going to say, okay, I'll give you the details on the resin.
Yep.
Okay.
Exactly.
Brilliant. Sure. Okay. So we've got that from fillings. Let's go to root canals, which obviously I think is crucially important. Maybe you can just speak about that documentary Root Cause that was pulled off Netflix. I'm sure you know the details because this might just, people might be listening and say, oh, documentary got pulled off, Netflix. That means a lot. People, they didn't want people to see that. But there was something like a 97% correlation, not causation, but correlation between someone who had breast cancer and a root canal on the same side. But speak into that space and what's happening with regards to root canal and your health.
So, root cause was an interesting thing. It really sparked a lot of interest in this whole discussion, which I was thrilled with because we were talking about it already, but people were really questioning the legitimacy of what we were saying.
Mm,
And the documentary was pulled after about a month of being out. And whose money did that? We can only suppose.
mm.
But there are 45 million root canals performed in the United States per year
Wow.
alone.
Wow.
So, what
Mm,
that means is there is a lot of business that's dependent on root canals. Excuse me. And there are a lot of practitioners that are performing them. I don't like to go to the conspiracy side of things,
mm,
but obviously it got pulled because someone didn't want it to be told, didn't want the story to be told. You can now find it. You can go onto a streaming platform and pay some money, pay $20, and you can watch it now. So you can get it again. But really, the summary of it is that root canals are never completely clean of bacteria. And it's just because of the way a tooth is made. There's a main canal inside of each tooth, and that main canal has feeder channels that go off. And it just makes sense, right? This is how nutrients get from the body all the
mm,
way to the part of the tooth that you see out here. There's the main canal and then tiny little feeder channels. The main canal can be cleaned and filled. The tiny little feeder channels cannot. So you always have dead tissue left in the tooth. Dead tissue always attracts bacteria, no matter what. This is why we don't, take your gallbladder out, fill it up with, rubbery stuff and put it back in. Why? Because the bacteria are going to find it. It's going to get infected. Same thing happens with the tooth. We clean it out, we fill it up with rubbery stuff, leave it there. Dead organ, dead tooth in the body. How does this correlate with cancer and any of these other concerns? Well, that bacteria does find the dead tissue. Now, this creates an immune demand. Your immune system has to go deal with it, right? It's got a low grade chronic infection that never goes away around that tooth. If immune system has to come and deal with this. Also, every single time that you chew, it's like a plunger pushing those bacteria through the bloodstream throughout the rest of the body. So the immune system has a pretty big thing going on here. Tooth is dead. You can't feel it. You have no local symptoms. This is the most common thing I hear from people. They'll say, well, I can't feel it. Nothing hurts. But one of my very favorite examples was actually the first time that changed my mind about this. I saw a patient and she had a root canal in this area right up on the top. She said, it's it's just never felt right. And that's real common words people will say. It's just never felt right, or something's just a little off. They never say it hurts. So we took a regular dental x-ray, regular old, the kind that goes in your mouth, snap it, looked at it, and I said, it looks fine. And every dentist that you had showed it to would have said, it looks fine. But I had just gotten my new cone beam CT scan machine. So I said, you know what? Let's go take a cone beam CT scan. What is this? It's a dental specific CT scan that's done in your dental office. It goes around your head and it shows everything in 3 dimensions, because a dental x-ray that we put in your mouth shows me 2 dimensions. I can see side to side, and that's about it, top to bottom, but I can't see front to back. I can't see bone. I can't see any of that. So we took the scan, opened it up, and she and I both just, took a deep breath, because there was a quarter-size hole in the jawbone above that root canal tooth where bacteria had eaten away her jaw, literally almost her cheek, and I could not see it on the dental x-ray. I had no idea it was there. So this is the issue. We don't know it's there. And all of that infection is draining somewhere. Where is it draining? Draining into the lymphatic system. The lymphatic system is just the sewer system of the body. Draining into the lymphatic system. The lymphatic system of the head neck drains into the right axillary area, basically the armpit. The left is kind of the rest of the body. So a lot of people will say things like, gosh, I'm always kind of a little smelly, but only on the right side. Guess what? You've got dental infection. You've got something going on because it's on the right side. But there's also something called dental meridians. And this has been studied for thousands of years from the Chinese forever ago, where they found that every tooth is connected with organ systems in the body. So if there's a short, and I liken it to, your house. If there's a short on the line where that light switch and that light and a couple of other things are connected, well, everything on that line is going to be affected as well. Same thing goes on with the body. So if you have a dead tooth that's infected right here on the line that goes right to your right breast, right here on that right root, right bicuspid area, or if you have an infected area where you had a wisdom tooth removed and that's your endocrine system, or a lung, large intestine right here, a lower molar, what we see is huge correlation between infection here and infection elsewhere. One of my very favorite stories about this is a gentleman who came in, and I saw him as a new patient, and my first thought was he looked orange. Like he just looked orange. And I'm pretty blunt. So a couple minutes into the conversation, I said, has anyone told you you look a little orange? And he said, everybody. They asked me why I do self-tannery. He said, I don't do any, I don't know what it is. We took a cone beam CT scan. He had gotten hit in the mouth when he was young with a baseball and had root canals across these front teeth. Guess what connection these are? The liver. Yeah. He had jaundice. He literally was jaundiced because of infected root canals right here in the front of his mouth. And I can tell you on and on and on and on. I've yet to find a person who has cancer that doesn't have infection somewhere in their mouth. I haven't found one yet, because the body cannot be healthy when the mouth has chronic infection.
Wow. Just say that again, because that could be causative or correlative, but just say it again.
Yep. I have not found one person who has had or has cancer that doesn't have an infection somewhere in their mouth. Sure. You simply cannot be healthy. Your body cannot be healthy unless your mouth is healthy.
So do you think it's correlative or causative there? Because, that's a massive statement to make. Is the cancer causing the infection in the mouth, or is it both ways?
I think it's correlative in that it creates an immune system deficit or immune system stressor. So now the immune system is unable to care for other things. And as I'm sure you talk about this all the time. Our bodies are incredible. We have 37 trillion cells, and those cells are replicating themselves every single day. Literally, your liver can remake itself in a month. The entire thing can grow back in a month's time. So every single cell is remaking itself constantly. Sometimes when those cells are remade, they mess up. The programming doesn't come through as it should. Well, your immune system's job is to identify those mismade cells and kill them. That's part of the work that it does. When one of those cells is not killed, but continues to replicate itself, that's what cancer is. So if your immune system is distracted, worn out, tired, dealing with something else 24/7, it's less capable of keeping your body at its best. Does that make sense? Less capable of killing those mismade cells that happen every single day in all of our bodies. It's less capable of keeping us well when it's working so hard to deal with this. So I don't think it's causative. I don't think anybody could say that from a tooth perspective, but it's 100% correlative. And you
Mm.
mentioned Thomas Levy. He talks about how literally 80% of what's happening elsewhere, there's some correlation going on in the mouth. He has research showing all of this, and
Mm.
it's actually come to life in my practice.
Sure. Brilliant. And let me ask you sort of a personal question that might sort of explain Nico, neuralgia-inducing cavitational osteonecrosis. There's another way as well. There's so many names and the nomenclature is causing problems itself. I mean, fatty, fatty degenerative osteonecrotic jawbone. I mean, you got that as
That's the
well. I
new
mean,
one.
chronic ischemic bone disease. I mean, there's so many names, number one. But even look at myself, 25 years ago, I was at a conventional dentist. I had two wisdoms taken out, no ozone, no PRF or PRP or anything like that. Go and do a cone beam at my biological dentist, and he sees these cavitations there and says, listen, you got two now. You got to go through this process, but it's a 3 week time off. It's this. You got to do it at the end of the year. I got a busy practice, busy sort of made to thrive team that's doing corporates. Is even if my inflammatory markers, I've been watching my bloods and doing all the diagnostic functional medicine tests for 18 years. And you talk about Chinese medicine. I've been a Chinese medicine doctor for many, many years. But so inflammatory markers are low, HSCRP is low, interleukin 6, interleukin 10. I really watch it significantly. Is there a case really? And he said to me, you've got to have it done. He had his own. He went to Switzerland to some of the biological dentists there. He said, yeah, you've got to have these cavitations sorted out as they could be a source of disease. Now, the question is 26 years, never missed a day's work to sickness or health, never taken a sick note. So my biological age from a DEXA's perspective and many other markers is incredible. Is there a case to actually make sure that these cavitations get sorted out?
So I have this conversation with patients all the time. And some people have symptoms. And in fact, we survey patients that we clean these lesions out, and people listening may not even understand what we're talking about. So this is an area where a tooth was removed that the jawbone didn't heal properly. It leaves a cavity, and other bones do this as well. You can get them in long bones and legs and arms if things have damaged and traumatized the bone and there's a dead area of bone there. They have to be removed. It weakens the bone. It also leads to less infection. I will say this, I've actually studied this very extensively. What we're finding is that these lesions are not as much infectious as they are inflammatory. And the inflammatory or the cytokine that we see ramped up in these areas is called aromatase.
Mm,
So that may be one to test for to see, okay, what are my aromatase levels? It's a little harder one to test for, but what are my aromatase levels? Because this is it's a prime, basically inflammatory signal that the body's sending saying something's not right here. So it's an area where the jawbone didn't heal correctly, leading to a dead zone that the body signals, not right, not right, not right, sends off these cytokine messengers, which are inflammatory messengers. Now, I tell people all the time, if you have symptoms, this is very much something to deal with, and especially endocrine system symptoms, because those wisdom teeth are in the endocrine meridian. So thyroid problems, adrenal issues, fatigue problems, all of the above. You don't have any of those. So if you were sitting in front of me, I would say, okay, now you know they're here, and you are checking everything, you're doing everything right. It's all about the bucket and if the bucket tips over or not. Right now, your bucket is completely empty because you're doing so many good things. That's why you're able to have no sick days.
mm,
The problem is we can't always predict what's going to fill the bucket. It might mean that something from a health standpoint changes for you. It may mean lifestyle, family. You
yeah,
have a family, heaven forbid, some sort of a tragedy, something
mm,
that tips your ability to deal with things over. Does that make sense? So some people choose to have these done preventatively so that it doesn't add to the burden, so that their body is more resilient to anything that comes along, where others choose to deal with it proactively once symptoms have occurred. So
yeah,
again, we survey patients and say, what did you get these cleaned out for? And they give us these results, and largely they're pretty significant symptoms. We say, okay, what were your results? Did you have symptom resolution?
yeah,
And about 89% of people say absolutely. The same percent of people say, I would recommend this be done by others as well. About 89% of our patients
Wow.
say, I would do this again and I would recommend that other people do because it resolved my symptoms. But you don't have anything to
Yeah.
resolve. So I had 3 of these myself, and I'm similar to you. Never sick day in my life, other than, I mean, even when I was deathly ill, I still showed up to work.
Yeah.
It's just what you do. But I thought, I want to give my body the best chance it has to stay where I'm at. So I got mine cleaned out about 3 years ago. And I'll tell you, I didn't take 3 weeks off of work. In fact, I watched the whole thing in the mirror while it happened. And it took 3 days. We tell people 3 days. So it's not necessarily to take 3 weeks.
Mm.
I take 3 days.
Okay.
Um, and it was worth it to me. Did I feel like this massive, huge change? No, because I'm already high
Mm.
perform, I'm already there.
Yeah, you're
But
living
I
on a homestead. I see where you're living, and you're living off the land, and you're
exactly.
living in Utah, and you're living in an environment. I mean, that's
Yep.
I don't know if that's 10 times more important than having it out. I actually don't know because you're getting good quality sun, good quality food. Looks like you've got a
Yep.
beautiful family, community. You got purpose. You're changing the world. What lever is it going to be? And maybe that's where I'm at, and I've got to earn my procedure, like I say. But
Yep. So
also,
it might be worth it for you from a preventive standpoint, just
Mhm.
so your body has its chance to do its very best all the time.
Yeah, no, it's true. What about hyperbaric? And I studied with Frank Schellenberger. I don't know if you know Frank Schellenberger
Yep.
from
Yep.
the
With
Head Up
ozone. Yep.
Ozone,
Sure.
many, many years ago. And he gave us, I haven't done a lot of it just because it's quite an intricate process taking ozone and injecting it in the gum here and that. He showed us all these dental procedures for people that just didn't get well. But if you use hyperbaric oxygen therapy or you take some, would that like heal? You think the bone? Is there a chance if there's not an infection, if there's a cavitation, if you get enough hyperbaric that could improve? Or maybe you take a bit of ozone in that area and you inject it in that area plus hyperbaric.
So we've looked at a lot of these things, and in our experience in our clinic, the answer is no because of the dead bone. It doesn't regenerate because there's a dead spot there, if that makes sense. So again, go back to the gallbladder example. If it were dead, you filled it full of plastic, you shoved it in your body, whatever. As long as it's dead, you have to remove the dead thing. And the same thing goes with the jawbone because we've tried laser, we've tried ozone, we've tried, oxygen, all kinds of things. And as long as there's a dead spot there, it's going to trigger that inflammatory reaction. So you have to remove the dead stuff. And there is dead stuff in these jawbones. You have to get it bleeding. You have to get it fresh. You have to get it so it's, the dead
Yeah,
stuff's gone.
I got you. All right. Okay. So
Unfortunately,
you.
I wish I could say differently, but you can try it. Feel free
Yeah,
to
it's
try.
It's crazy. What's been quite contentious now, what's happening on one of my guests, incredible, I don't want to mention his name, but really, really helped me understand genetics. He did a little reel that got, and talking about Instagram, whoever's listening on YouTube, we've got to give the handle because, Dr. Michelle's handle is absolutely incredible. Her work is amazing. I think it's Living well with Dr.
Dr.
Michelle.
Michelle.
That's exactly what it is.
Yep.
We'll put the links in there, but spoke about the damaging effects of not using an electric toothbrush, which was quite interesting. And I didn't want to, haven't done my research, because you're doing so many research in so many areas. But let's talk about the electric toothbrush. What Dr. Thomas Levy and who was a doctor, I'll think of him now, who's been on my podcast, incredible, showed me about hydrogen peroxide nebulization and using hydrogen peroxide in a water flosser. So I'm just putting these on your radar now in terms of oral hygiene because people are going to be listening and then obviously not using fluoride toothpaste. But let's talk about just oral health. Someone's listening and saying, okay, what should I do? Should I use an electric toothbrush? Should I use a water flosser? I use a water flosser with hydrogen peroxide in. I think that's been incredible. But give us Dr. Michelle's sort of protocol.
Yep. So really it's going to get to root cause. What causes dental disease? What causes tooth decay? What causes gum disease? What really causes all of this? So tooth decay, there are 2 causes. Unfortunately, the only one that we usually talk about is the first one you just did,
Mm,
which is toothbrushing, tooth products, actual things you're putting in the
mm,
mouth. That is one cause. We need to address the other one too, but let's talk about that one
mm,
first. So really, there are no magic bullets here. You just have to get the plaque off the teeth because what causes the cavity is acid. Now, sugar doesn't cause a cavity. Sugar in the mouth, bacteria eat it. And the bacteria, for lack of a better word, they poop out acid. So they eat sugar, they poop out acid. That acid dissolves minerals in the tooth. It's just like if you were pour Coke over top of like a battery terminal on a car battery, it dissolves all of those minerals. So the acid from the bacteria or from your mouth or from your diet. So if you're drinking, swigging, soda and energy drinks, this is a big problem in the United States. If you're coating your mouth with acid, all that acid dissolves minerals. And your teeth, the enamel, the part that you see, is highly mineralized. It's just made of a compound called hydroxyapatite. So you put acid on it, it's going to pull the minerals out. It's going to leave holes where those minerals came from. It's really simple.
Mm.
Bacteria then crawl into those holes. They eat more sugar, they poop more acid, and they dissolve more minerals, or more soda or energy drinks get into those
Mm.
holes and dissolve the minerals further and further and further. As the bacteria crawl in, you now can't get the bacteria out of those holes anymore, the deeper it goes. So this is why you actually can heal a cavity when it's on the outside layer, because it's just a lack of minerals. You can fill that tooth back up with minerals, get the bacteria off of there, clean them real nicely, fill that up with minerals, and you actually can heal a cavity if it's in the mineral layer. Once it's into the deeper layer, those little feeder tubes I talked about earlier, those bacteria are spreading. It's kind of like a super highway and they go real quickly. So usually once it's into that deeper dentin layer, we're saying go to the dentist, get it filled. When it's in that outside layer, use hydroxyapatite. It's the mineral your teeth are made of. There's now tooth care products. There's tooth powder. I have a tooth powder. I have a new toothpaste coming out in a week. All of these things have hydroxyapatite, literally just the stuff your teeth are made of. So does it matter if you use a manual toothbrush or an electric toothbrush? It matters more how well are you cleaning. Now, typically in most people's hands, an electric toothbrush is going to be more effective. You're going to get into the nooks and crannies better. So it's less which one is better and it's more how do they clean. So if an electric toothbrush will get to places that you don't, will do a better job than you do with just your hand motion, then please use an electric toothbrush. If a water flosser will get into nooks and crannies that you can't, then use a water flosser. It's just about getting those bacteria off of the teeth,
Mm.
because if they stay there, they're going to be dissolving minerals and it's going to lead to either tooth decay or gum disease, because bacteria also drop all of I like to think of it garbage. They drop their garbage all over the gums and the gums start to pull back. They say, oh, that's bad stuff up there. I got to get out of the way. So hydrogen peroxide's awesome. Why?
Yeah.
Because it's oxygenating those bacteria that don't like oxygen. The bad dudes that are hiding in those real deep areas.
Mm.
Hydrogen peroxide's oxygenating and wiping them all out. So again, what you want to use is something that's going to do a good job. Use an electric toothbrush if you need it. Use hydroxyapatite tooth products. Use use hydrogen peroxide if necessary. I love colloidal silver also.
Mm.
Colloidal silver is also a very good liquid for putting in the mouth and killing bugs where they shouldn't be. So those are all things that I will use to clean the mouth and recommend to clean the mouth. You just need to have your teeth clean.
Sure. Okay.
That's one side.
Yes. Go for the second.
Second side is cavities also come from the inside.
Mm.
So if your body needs more minerals than it currently gets, either through diet or because you have gut absorption issues, your body will sacrifice the teeth to feed your brain, your heart, your other systems and organs that are essential for life. Because guess what? You can actually live without your teeth. Your body knows this. I was telling you before we got here, I just got back from a trip to Morocco. I've never seen worse teeth in my whole life. Oh my gosh, the teeth there are horrendous. Why? Well, I think it's two reasons. They love mint tea with a lot of sugar. So they're bathing their teeth in the sugar that the bacteria love. And number two, I don't think they're getting all the minerals and nutrients they need on the inside either. So their body's stealing minerals from their teeth. So this often happens when people are pregnant or teenagers or some of these other times that have, if you think about it, a teenager's growing bones, right? They're growing their own bones. Like they're growing taller, longer, all those things. Pregnant woman is growing bones and teeth, right? And the baby. High demand for minerals. So if your body is not getting enough minerals, it will steal it from the teeth. And I'll see perfectly clean teeth that are getting cavities. So you have to feed your body minerals as well to combat tooth decay. It's not all about brushing.
Yeah, and that's, I mean, you got to go into the website as well. Those that are listening, it's an incredible website. It's livingwellwithdrmichelle.com, and go and have a look in terms of where she's living and what she's doing, and all the programs, serving the community, the Living Well Foundation, standing in front of these, what looks like greenhouses. So obviously food, the soil, the microbiome. I mean, this is, one doesn't want to use the word holistic, Michelle, but this is from A to Z. I mean, this is, from it's Weston Price. It looks like you're the Sally Fallon and Weston Price, sort of the modern Weston Price. And we could have a whole podcast on Weston Price. But what an incredible show. And I want to just declare favor and blessing over you, your family, and you've paid a price, and you're writing this book, 20th of May. Please go and pre-order. We'll put the link, as many, because that's going to help just propagate this book. And I think you have a beautiful soul to see people's lives change because of what you've gone through. Brilliant website, products that are there. And so, yeah, well done to you. And you've got a place here in South Africa to come and stay. I offer that all to all my guests. You come stay, you've got a network, it's an incredible holiday. Really, your dollar goes far in this country. And so, what a privilege to have met you, and what an honor to support you.
Thank you so much for all you are doing. I
Mm.
appreciate you getting this information and knowledge out because, like I said, that's how things are going to change.
Brilliant. Okay, just last thing. Maybe I've missed some of the links, but where can people find you if they're listening on the road, or they're running, or they're jogging? Where can they go?
Yep, livingwellwithdrmichelle.com, and it's doctor just drmichelle.com. And the book is at livingwellbook.com. Please pre-order, let the publishers and others know, booksellers know that these are the kinds of books you're interested in. It's not just about teeth, it's actually about how your cells work and
Hmm,
how you can stay well at home, doing your own thing without even, and how to really choose the kind of medicine that's going to work best to help support your cells.
brilliant. Thank you, Michelle.